Hello there, everyone, and welcome. My name is Sarah Hunstead. I am a paediatric nurse, a mum of two, and founder of CPR Kids. And we are talking to you about nappy rash today. So, who is the we? It's the fabulous Dr. Deb Levy, who is a paediatrician and just all-round wonderful, nice lady as well. And we are going to be talking to you about nappy rash, and we are coming to you from Gadigal and Bidjigal land today. And Deb, why don't you do your introduction? Tell us a bit about yourselves for those who haven't joined us in the past.
Great, thanks, Sarah, and you always give me such a kind introduction. Yes, my name is Dr. Deb. I'm a holistic pediatrician. Sarah and I have been working together for many years, initially in clinical practice at one of the major emergency departments in the Children's Hospital. And now we do this, which we really, really love doing. Both of us have the passion of giving you as parents and caregivers the knowledge that you need in order to help your child thrive. I currently work in private practice in the eastern suburbs, as well as providing online education resources for parents. So let's dive in today to a popular topic, and that is diaper rash or nappy rash, depending on which country you are coming to listen to us from. So that's one thing, actually, two things actually I want to mention. One, we'd love to hear where you are listening to us from, whether it's local or very far away. It's always great to know. And two, I am happy to answer questions, as is Sarah. Obviously, we can't answer specific medical questions in this format, but by all means, make comments and I'll do best I can. And sorry, my light has just gone out, so I just got a bit dark.
That's all right. We can still see you. All good.
And yes, let's dive in. Sarah, does that sound good?
Yep, absolutely.
Canada. Wonderful.
And Houston,
I just
Texas.
got back from Canada. Yeah, well, funnily enough, I've got family in Houston, and Canada, I just got back from there last week. So I was in Toronto for 2 weeks. And I don't know where you're coming from in Canada, but there was bizarre weather, and we even had snow, which was a bit unexpected. Yeah, my girls are very excited. I have a 5 and 7-year-old, a 5 and 7-year-old daughter. But yes, it was. We weren't really expecting it.
That's pretty exciting, actually.
I know. Oh, there you go, Toronto. Well done. So you experienced it as well. Hopefully, it started to warm up then. You're having some proper spring weather.
Yes.
Okay, so today we're going to talk about diaper rash or nappy rash, whatever you want to call it, basically because it's really, really common. It can be distressing. And, when you get onto Google and ask questions, you can just go down that rabbit hole. And that's what we're trying to do here, is just to cut down to the chase, give you, evidence-based facts as well as practical tips that we as clinicians as well as parents know work. Should I just keep going, Sarah, or do you want to butt in with anything?
Oh, well, the funny thing is this is usually the space, if you've watched our lives before, where I go, my child had this and this happened, but I don't really have much to say with this one.
Good. That's a good thing.
Then, and so I'm going to be relatively silent and learning from you here. I have seen lots of kids who have come into the hospital with, the extreme cases, but we want to try and, prevent that from happening. So what I think we should start with is, what exactly is nappy rash and what are the causes?
Great. Well, I mean, a nappy rash is any kind of rash in the nappy area. And so, we can talk about the classic one, and I'm even happy to talk about other things like vulvar vaginitis and that, if that comes up, if families would like to hear about that. But, classically, we're talking about a young baby who's in diapers, not yet toilet trained, and gets inflammation plus or minus secondary infection of the skin. So inflammation of the skin, the fancy name for that is dermatitis. It literally just means inflammation of the skin. And what it looks like is it's red. It can be painful. It can be patchy. It can be confluent. It can look a little bit different depending on exactly what's causing it and where it is. So, often as clinicians, we'll make a distinction between rashes that sit within the folds, those nice, beautiful, chunky folds you get, or ones that sit on the outside. But practically speaking, for you as a caregiver, is if the area is red, if it looks irritated, if your baby seems to be uncomfortable, by all means, that's a nappy rash. So by far the most common cause is exposure to an irritant. And what's an irritant? It's anything that changes the pH, the acid base of the skin. And the classical one is, no prizes for this one, pee and poop. And that can be affected, especially the poop, by what your child is eating or if they're unwell. Again, classically, the story will be, my child's had some diarrhea, some gastro, and now they've got a bad nappy rash. And that's merely because there's been added exposure to the skin of that irritant. And I'll come back to irritants and what to do when I talk about my simple like 5-step approach to managing nappy rash at the end. So really that's the most common cause. And if you nip it in the bud at this stage, it's usually very short-lived. And that's probably what you were touching on, Sarah, in terms of the nappy rashes that your children have had, and certainly mine have had these as well. The next point is sometimes they become infected. Most commonly, that infection is fungal and something like Candida. And typically, the rash will just continue to look red. May also, you get what we call satellite lesions, which are these little like blotches of red extending from the rash. And the other possible secondary infection, which is a lot less common, and that's what, again, maybe Sarah's mentioning what we've seen in emergency, is when there's a secondary bacterial infection.
Yes.
Something like staph or strep. Yeah.
And I've certainly seen a lot of the staph. Yeah.
And that can be really quite nasty and really quite painful for children. And that is, not only is it red, you can sometimes then get crusting. It often becomes quite itchy and really quite distressing. But it takes quite a bit to get to that. It's very unusual for that to happen within a day or so. Wouldn't you agree?
Exactly. And I just want to allay your fears. If anybody's going, how will I know if it's a bacterial infection? Or trust us, you will know. Your baby will be so uncomfortable. You will look at this, and it looks horrendous. Like, it really does. It looks painful and red and angry, and you will know. Okay, trust us.
Exactly. And I'll also talk about, when do you need to see your doctor as well. So actually, maybe I should just go into treating it now. I think it's quite clear what a nappy rash is. So for those of you who know me, and Sarah does, I like to come up with really simple ways for you as parents to remember things. And I talk about my ABCD of treating diaper rashes. Let's hope I remember them all. So A is avoiding irritants. And when I talk about irritants, I've really touched on the main two. So that's pee and poop. That's making sure you change diapers regularly. That's also about choosing what you're going to use on your baby's skin. So whether that's from the actual diaper, are you using disposable? Are you using the reusable ones? There's different absorbencies. So just be aware of that. And that may dictate how frequently you need to change. But obviously, we need to change our baby's diapers as frequently as possible, as necessary is probably the better way to put it. As soon as you can after a poop, for sure. And, with the pee, you can leave it a little bit longer, but not if it's drenched, and not if it's one of the reusable diapers, because often they're not as absorbable. So avoiding irritants. And also, sorry, I didn't mention the importance of choosing wisely when it comes to what you're cleaning your baby's skin with. Because if you are using, let's say, baby wipes that are pumped full of chemicals or I almost said flavorings, fragrances. Yeah, definitely not flavorings. Fragrances. It's much more likely. I know, right? It's much more likely that it's actually, must be the jet lag. It's much more likely that it's actually going to either extend the nappy rash or maybe even cause one. So just be aware of that. If in doubt, switch to a very simple one. Sorry, my dogs are in the background. A very simple one, or even just use water and cotton wool. Just clean water and cotton wool.
Yeah, certainly that's
So
something cheaper as well. I
it
remember
is.
I just bought a big pack of those super soft little baby face washes. And,
Yeah.
obviously not for going out, but at home, we would just use water in those super, super soft baby face washes. And it was great.
Yeah.
And you just put them in the machine and you're done.
Exactly. So the next, so that's A, that's avoiding irritants.
Mm-hmm.
B is barrier creams. So what I mean by barrier creams, exactly as the title says, it's really a cream that you put on the skin that seals the skin so that the irritants actually can't get to it.
Mm-hmm.
A zinc-containing barrier cream is all you need. You don't need anything fancy. There's certain brands that I prefer. The bottom line is choose something that is
The
as
bottom
pure as
line.
possible. I know exactly. We're full of it today, Anna. I didn't even mean that. So, yeah, so that's the other one, barrier cream. So I'm not a huge talcum powder fan. I don't think it actually does anything. And even corn flour and all these other things, obviously talcum powder, there have been some potential health risks with that. So
Yes.
the companies have changed away from those formulas. But again, I must say, I've never seen a huge benefit to them. I'm sure that some parents are going to go, no, they've done everything for my child. They're the best thing ever. But this has just been my experience and with looking after patients. The other thing that parents will often use are things like pawpaw cream and coconut oil. I don't know. I've again had a bit of mixed reviews on that. Me, I prefer sticking to the zinc cream because I know that it just seals the skin beautifully and makes it much less likely there's going to be any contact. Okay, so that's the B for barrier cream. The C was for changing regularly again, and that's just another reminder. And D is diaper-free time. So as a parent, I was seldom brave enough to do this. But I think that if your child has a diaper rash, there is some benefit to it. And obviously try and do it after they've made a poo, I think is probably the wisest time or the lowest risk time.
Mm-hmm.
And just getting them
unless
just
just not on the carpet. Yeah, just not on the carpet.
Exactly right.
Have the towel down or something
my
like
dog's
that,
hiding.
over the hard floor. Yeah.
Exactly. We're ready to mop up any accidents. So that's your diaper free time. And then the other D, so that's A, B, C, D, D. The other D is know when to call a doctor or when to see a doctor. And that really is, you can look at it at the nappy rash itself and you look at then the baby as a whole. So if your baby is unwell in themselves, fevers, irritable, not feeding, there you go. You don't even have to think about it twice. Please take them to go and see a healthcare provider. The actual diaper rash itself is if it's not getting better within a couple of days at home, if it's getting worse, and if it's extremely severe. So those are really, the reasons why I would seek a doctor's opinion. And then the question is, well, they may actually suggest medicated creams. And classically, a cream that I would use would be something with like a steroid plus an antifungal in it. Or if I think there's a bacterial infection, I may treat for that as well. So, but that again is under the guidance of your healthcare provider. So I think that, that's kind of my diaper rash in a nutshell. I'm happy to answer any questions, or I'm happy to talk about anything else in the diaper area if anyone has anything to ask.
Excellent. I have a question. Are there certain foods that may promote nappy rash in the fact that they can be more irritating, or does it just depend on the child?
Look, I honestly think it depends on the child. Maybe acidic foods, dairy is probably a big one, actually, because that can cause a lot of loose poos if excessive dairy. Obviously, these are children on solids. A change in a formula can make their poop change. Change in mum's diet sometimes, or if mum's been unwell. So, I mean, I don't think there's any specific food, to be honest with you.
Yep. Okay, excellent. Ophelia has asked a question. Ophelia has said, should Vaseline be used as a barrier cream? So you just touched on the fact that you really like barrier creams with zinc in them. You know that they're going to do that really good job. But rather, obviously when we say Vaseline, that is a petroleum jelly.
That's it.
So your thoughts on that?
Well, I think that you've just nailed it by saying petroleum, and it's just, for those of you who know me, I prefer to try and avoid, um, the more artificial substances. I know that zinc is artificial as well, but I'm just not a huge fan of petroleum. And if that's all you've got, by all means use it. By all means try it. It's the same kind of, it'll give you that same covering as paw ointment. It doesn't, in my opinion, work as well. But if that's what you've got and you find it works, sure, go ahead and use it.
Okay, excellent. Thank you. And so now is definitely the time to be typing in your questions down below in the comments. They'll pop up and we will discuss them now. If you are watching this as a recording, unfortunately, we aren't able to answer your questions once we're not live anymore. But what we would love you to do is post in the comments below what you would like us to talk about. So we have, certainly a whole list of things that we've got written down to talk about for the rest of the year as well. But if you really want us to talk about a child health subject in particular, please let us know, because we would love to do that. And the other thing that we would love you to do before we get to a couple more questions is go jump on Instagram as well, because we've got some really good information that goes out on there. Deb and her fabulous infographics as well. So make sure you go see Deb. And is something going on? Are the dogs okay?
I know. First my dogs were fighting, and now the one's gone off. Obviously there's a noise outside. So the perils of being at home.
Yeah, I know. That's it, isn't it? I know. I've got mine just laying on the other side of the door, just waiting for me to come out. So Seema has asked, hi there, I have found diaper rashes more common in newborn than babies aged older. Is there a reason for that?
I actually think it's because newborn skin is more delicate, and they often pooing more often as well. So I think it's a combination of the skin being more sensitive as well as a higher irritant load.
Oh, I like that. Higher irritant load. Excellent.
It sounded very scientific. Otherwise, saying it's lots of poop.
It's brilliant. Very good.
Gotta love us medicos, right?
Yeah, that's it. Higher irritant load. Yeah, I can see it with capital letters as well.
Yeah.
Ophelia has also asked, is there such a thing as putting on too much or too little diaper cream?
Too little, as if it's not doing its job and they're getting lots of diaper rashes. Too much, it's probably just hurting your pocket. In other words, you're just wasting money.
Yep, exactly.
And so no, you can't put too much on.
Okay, one parent tip as well, that I feel that if you are a new parent and your child is not mobile yet, that you make it a habit now of keeping the nappy rash cream or the barrier cream up and out of the way, because you do not want your toddler accessing it. Number one, we don't want children to think that they can just grab something and eat it, because one day they will eat something that is very bad for them. But zinc cream and likes, getting that off carpet or bedspreads and other thing is near impossible. So make sure that you really do keep those things up and out of the way, particularly as your little one becomes mobile, because remember, they want to copy what you do. So if they see you always putting your, that cream on, they want to copy it. Keep it out of reach.
And also, inevitably, a baby's first role is when they're on the changing table when you're not looking.
Exactly.
So just be aware of even little babies can fall off change tables.
They absolutely can. And Deb and I have certainly seen that many more times than we want to. So it is always one hand on the baby, have everything around you so that you don't have to reach for anything. And if you do, you are taking bub with you. A good alternative, of course, some people do need to have the high, if you've got back problems, things like that, then yes, you may well need a high changing table, but otherwise on the floor. It's one of the easiest places, and then there goes that risk of them falling off.
Great.
Excellent.
Thanks, Sarah.
So,
I don't think there've been any more
no
questions
more
coming through.
No,
Excellent.
all
So
good.
we'll see you all next week. Same
Next
time,
week.
same place.
Same time. Okay. See you later,
Wonderful.
everyone.
Thanks, everyone.
Bye.
Bye.